Hello and welcome to the Answers for Cancers podcast. So today we're going to talk about some of the pre-treatment tests required before you start CMF chemotherapy. So before you start chemotherapy, you'll have some pre-treatment tests, and these are also known as baseline tests. So the tests that you have before chemotherapy do depend on the specific type of chemotherapy that you're having. So the ones we're going to speak about today are the ones required before you begin CMF. So the first type of tests that you will have are different types of blood tests. So a full blood count, a liver profile and a renal profile are the three different types of blood tests that can help provide important information about a person's health. You do not need to fast before these tests unless you are specifically told by your healthcare provider. So a full blood count is a blood test that measures the different components of the blood, including red blood cells, white blood cells, neutrophils and platelets, and these are all different important measurements to take before you start any chemotherapy. So this test can help provide important information about a person's overall health and can also help identify conditions such as anemia, infections and different blood disorders. So a liver profile, also known as a liver function test, and a renal profile, also known as a renal function test, are blood tests that can measure different enzymes and proteins produced both by the liver and the kidneys, and these tests can help assess the health and function of the liver and the kidneys. So if you want to know more information on the specific enzymes and proteins that I'm referring to here, you can find some more in-depth information on the written information provided within this app. So moving on from that, the second test required before starting CMF chemotherapy is something referred to as a DPD test, and this is also a type of blood test. And this test is done prior to the first treatment. However, it's important to mention that sometimes this test isn't back before your first treatment has been scheduled. So oftentimes your consultant may go ahead with the first round of chemotherapy before this test is back. But this test is used to assess the activity of the DPD enzyme, which is naturally found in the body. And this enzyme is involved in the metabolism of certain drugs, such as 5-fluorouracil, which is a part of the CMF regime. So individuals with low or absent DPD enzyme activity may be at risk for developing some more severe side effects from 5-fluorouracil chemotherapy, such as myelosuppression, neurotoxicity and gastrointestinal toxicity. So therefore the DPD test may be recommended prior to starting this chemotherapy to identify patients who may be at risk for these adverse reactions. So it is important to mention that it's quite rare that we do see results with low or absent DPD enzyme. So it's not something to overly worry or concern yourself about, but it is an important test to have before starting this type of chemotherapy to ensure that we do identify those very few patients that may have a low or absent DPD enzyme activity in the blood. So like I said, it is just a blood test that's taken like any other normal blood test, and it can take a couple of weeks for this to come back, and sometimes it comes back as normal, intermediate or deficient in the DPD enzyme. It's also very important to note that while DPD testing helps identify individuals at risk for severe side effects of this type of chemotherapy, it is not a guarantee that adverse reactions will not occur in the patients that have a normal status. So other factors such as individual differences in drug metabolisms and genetics may also play a role in the development of side effects. Therefore, patients receiving this type of chemotherapy should be closely monitored for signs of toxicity regardless of their DPD status. And it's also just important to mention that this test can take a few weeks to be reported, so your oncologist may decide to proceed with your treatment before this result is reported. And this is quite normal procedure, just in case you're concerned about your result not being back in time for treatment. It's very commonplace for the treatment to go ahead before this result is back. So moving on to some regular tests, and these are tests that you will have through the duration of your cycles of CMF. So the first one is a full blood count and liver and renal profile, like we spoke about at the start for the baseline tests. So these will be continued throughout every cycle, and you will have the full blood count, liver profile and renal profile monitored before you start each cycle. And depending on your hospital, you may have these blood tests done the day before or the day of treatment. And then secondly, disease monitoring. So disease monitoring should be in line with your treatment plan and any other tests as directed by your supervising consultant. So this usually involves a CT scan of the body before you start treatment, and then when you complete the prescribed cycles of chemotherapy. So another way of disease monitoring is through specific type of blood tests. So a blood test known as CA153 is a protein made by a variety of cells, particularly breast cancer cells. So this blood test can be taken intermittently throughout your treatment to give some indications how the body is responding to the treatment. And this is usually at the discretion of your consultant. And just to mention that these pre-treatment tests and regular tests are all based on the National Cancer Control Programme guidelines, which are used nationally in Ireland. And if you require more information, you can find the guidelines used for this treatment within the app.